Good afternoon, all. Myself, Dr. Ankit Patel, medical gastroenterologist and endoscopist at Kaizen Hospital, Ahmedabad. Today, we will discuss about one type of inflammatory bowel disease, that is Crohn's disease. Crohn's disease is one of the type of inflammatory bowel disease that is characterized by inflammation, edema, and ulceration in the gastrointestinal tract. Gastrointestinal tract includes oral cavity, esophagus, stomach, small intestine, colon, rectum, and anal canal. So basically, Crohn's disease can affect any part of gastrointestinal tract. So what is the etiology of Crohn's disease? Crohn's disease is a autoimmune disease with some genetic predisposition. So what are the clinical features of Crohn's disease? Clinical features can be intestinal or can be extraintestinal. Intestinal clinical features include abdominal pain, vomiting, weight loss, altered bowel habit, can be diarrhea, can be constipation. Sometimes patient can present with bleeding per rectum also. In extraintestinal features, patient can present with joint pain due to arthritis, skin rash, blurring of vision or redness of eye due to episcleritis or uveitis. And depending upon the organ involvement like pancreas, gallbladder, biliary system and liver, patient rarely can present with jaundice. Now, how to do diagnosis of Crohn's disease? There is no single gold standard test for diagnosis of Crohn's disease. It is a conclusive diagnosis by blood, stool, colonoscopic and biopsy. In blood investigation, ESCA report can be positive. In a stool examination, fecal calprotectin will be positive if disease activity is ongoing. In a colonoscopic examination, there will be inflammation, edema, loss of vascular pattern and ulceration. Ulcer can be small or can be large and deep also. From that, we will take a biopsy and we will send for histopathological examination and it will confirm our diagnosis. To confirm our diagnosis, to know the extent of disease and to know the complication like stricture or fistula, we can do CCT abdomen with enterography or MR enterography. If suspected small bowel Crohn's, capsule endoscopy can be done. After diagnosis, after confirmation, what is the treatment? Prior to treatment, one important thing is to differentiate tuberculosis, intestinal tuberculosis based on history, examination, blood investigation, stool examination and colonoscopic features with biopsy. That is most important predominantly and especially in India. So now next, how to do treatment of Crohn's disease? If patient is low risk, we will follow step-up approach. In that disease, for induction remission, we will start steroid. And for maintenance remission, we will use azathioprine. But if steroid dependent or steroid refractory condition, we will start biologics. So it is called step-up approach. But if patient is high risk behavior, we will follow top-down approach. In a top-down approach, we will start upfront biologics. So first question is, what is high risk behavior? High risk means age less than 30, extensive involvement, large deep ulcer, perianal fistula, internal fistula, one or two or multiple prior surgery. With this high risk behavior, we will follow top-down approach. In that, we will start upfront biologics. Biologics can be infliximab, adalimumab, vedolizumab and ustekinumab. Currently, ustekinumab is not available in India. Most commonly used biologics are infliximab and adalimumab. So depending upon the patient's condition, we will start infliximab or adalimumab, and regularly we will follow clinical examination and we will monitor colonoscopic examination and therapeutic drug concentration, and we can achieve induction remission and maintenance remission. So this is pharmacotherapy based on risk behavior. It can be step up approach, it can be top down approach. Now next question, what is the role of surgery? Actually, surgery is not curative in the treatment of Crohn's disease, but any time patient develop stricture or complex fistula or malignancy, our surgical colleague will help and it will palliate the treatment. But obviously surgery is not a curative treatment for Crohn's. Now I will conclude my talk with the final message that early diagnosis and early treatment with biologics, predominantly disease modifying drugs, can prevent the stricture and can prevent the fistula. Thank you.